So remember, the problem with heart disease is clots, right? So I talked about omega-3 oils. Why? They prevent you from getting clots. I talked about fiber. Why? Because it prevents inflammation so you don't get clots. Well, stress is the other side of that. When you get clots, you need to repair those. You need to dissolve the clots. You need to repair the blood vessels that have clotting in them. And if you have a lot of stress, you don't repair. So it prevents your what are called APCs, the cells that line the arteries. It prevents them uh, from creating the new lining of your arteries and allowing the blood to flow well. So you end up getting more and more clotting when you have more stress.
Oh, hello. Welcome to the Healthy Heart webinar. Dr. Saunders is getting his stuff figured out here. And some of you who were on the webinar yesterday may have an idea about where he is today. Where in the world is Dr. Scott Saunders? Do you remember that? Was that a show? It must have been Carmen San Diego. Where in the world is Carmen San Diego? Okay, someone has to know. But Dr. Saunders,
No, go ahead.
okay, where are you today?
I am in Honolulu.
Awesome. So cool. Hey, can you show us that background the other way really quick?
Oh yeah. Okay. See, we got. There we go.
Cool.
There we go.
Very cool.
This is beautiful over here.
Mm-hmm.
Wow. Rough vacation.
Amazing. So amazing.
Yeah,
I love it.
that's awesome. Well, we are excited that you took time from your vacation to be with us today. Dr. Saunders is with his family, or some of his family, I think, in Hawaii. So hopefully this will work out. And well, who is this man with you? Is this your brother?
That's my brother.
Oh,
Yeah.
Brother Saunders.
it's kind of frozen, which frozen on a funny spot, so that makes it better. But okay, so guys, today we're going to be talking about keeping our heart healthy. And if you are here for the first time, we would love to hear from you. So comment in the chat. Let us know if this is your first time here. We primarily talk about the Healthy Heart Solution Kit and what we can do to increase our heart health or to reverse any heart problems that we may be having. That is our goal here on the webinar. And so I just want to remind you that Dr. Saunders is not your doctor. He is a great doctor, but we have to say that we want you to talk to your primary health provider before you implement any of the things that we talk about today. So today we're going to be talking about the basics of keeping our heart healthy. And so we want to take your questions. Feel free to post those in the Q&A if you wouldn't mind. That's kind of the best place for us to manage those. And we're going to go ahead and get started today. One of the things that comes up in a lot of questions, Dr. Saunders, is, well, first of all, this is probably the most common thing that I get. What pill can I take to reverse my heart problems? I do hear that a lot because I don't blame anyone for asking that. That's what I would want too. What's the easiest way to reverse something, right? But we want to talk about if someone came to you and they said, here's the deal, I'm having problems. I want to do this in the fastest way possible. What would you tell them to do?
I guess I've actually had that. I had a patient who came and his coronary calcium score was over 1,000. It was really high. I think it was like 5,000. It was really high. And he was told that if he didn't have a cardiac bypass surgery, that he was going to be dead in a month. There was just like no way he could survive this. This was really bad. So he came to me and he said, you know what? I need like right away. I need to reverse this. This is like really important. And what's the fastest way to do it? And so we talked about options of things he could do. And he said, okay, I am gonna fast with water only for 30 days. And so for the next 30 days, he drank only water. He didn't have any food at all. Because during fasting, the body repairs everything. It cleans everything out. And so all the cleaning, all the repairing, cleaning of your blood vessels, that all happens when your stomach is empty. So he said, okay, I'm going to keep my stomach empty for 30 days straight. And he did. And at the end of 30 days, he was playing a full game of tennis, and then going and working out at the gym, and he had zero chest pain. So in a matter of 30 days, it completely reversed his heart disease. So I can say it's possible, you know, and you can do it that fast. And because he did it.
Wow, that's amazing and awesome. And you know what? There have been some amazing stories that have come from many of you who are on these webinars talking about the changes that have happened for you when you fasted. Let's say maybe fasting isn't your thing and you don't want to start there because it can feel overwhelming. You're unsure. We talk a lot about smaller fasts, you know, where you maybe want to start implementing more of a 6-10 reset where you stop eating by 6, you go to bed by 10, and you get up in the morning and eat. But maybe that isn't even fully where you can start. Let's talk about food. What is the impact of food on our heart? And what are you finding that really is starting to make a significant impact on people's heart health as far as food is concerned?
Wow, food is huge. You guys, it's a lot. And we do pin a lot on food. And it is very meaningful. So if your diet consists of things that cause inflammation and cause clotting, then you are likely to have more heart problems. So we talk a lot about food and avoiding things that cause inflammation. So things like omega-6 oils. When you have high omega-6 and low omega-3, then your body makes more inflammation because omega-6 oils are the precursors of the inflammatory mediators, the ones that cause inflammation. Omega-3 oils suppress inflammation. So that is really big, and we don't talk about it enough in our society because all of our advertising centers around cholesterol and blood pressure because there's medications for that. There's no medication for a diet, for a good diet, for omega-3 oils, for example. Well, there is, but there's no patent on it, so anybody can sell it, and so it's not a big deal in the industry. So you know, when you think about what you hear on what you hear from a doctor, what you hear from nutritionists and everything, that all comes from marketing. And if there's no market for it, then you can have a living not right. So cholesterol, it's not a big deal. We make a big deal out of it. It's not a big deal. Omega-3 oils, that's a big deal. So eating things like fish and having flax seeds and chia seeds in your diet, and avoiding things that have vegetable oil to eat. Another important thing that we talk a lot about in the Healthy Heart Solution Kit is to make sure you get enough fiber. Fiber is so important for lowering inflammation. Fiber helps the right bacterial inflammation, and you don't have clotting, and you don't have heart disease, and you repair more easily. So diet can have a big effect.
Okay, I think we got most of that. Was it cutting out for you, Cheryl? Yeah, okay. I think we got most of it, but the last thing that he mentioned was just really fiber, really incorporating more fiber into your diet. And we talk a lot about that. We've talked about that on other webinars as well. And so I'm going to encourage you to go to bartonwebinar.com. That's our hub. You will find a link to our YouTube channel where you will find all of our past webinars. And we have talked at length about these things that we're discussing today. And if you really want to hone into certain things, you can find the webinar just on fiber. You can find a webinar on fasting. Another important thing that I think we have to talk about, and Cheryl and I were actually talking about this before we even started, is stress. What impact does stress have on the heart, Dr. Saunders?
Oh, it's huge. Okay, so remember the problem with heart disease is clots, right? So I talked about omega-3 oils. Why? They prevent you from getting clots. I talked about fiber. Why? Because it prevents inflammation so you don't get clots. Well, stress is the other side of that. When you get clots, you need to repair those. You need to dissolve the clots. You need to repair the blood vessels that have clotting in them. And if you have a lot of stress, you don't repair. So it prevents your what are called APCs, the cells that line the arteries. It prevents them from creating the new lining of your arteries and allowing the blood to flow well. So you end up getting more and more clotting when you have more stress. It's not a good thing. It is stress when you have a lot of cortisol. It blocks the repair of your intestines. That's really important because remember, cortisol is a catabolic hormone. It's a hormone that breaks down your body. It's not a repair hormone, and that's what we were talking about fasting. The ghrelin is that's made by your empty stomach is a repair hormone. It's an anabolic hormone. And so you want human growth hormone that's made from ghrelin, and you don't want cortisol that's made from stress. So stress is a very big factor in heart disease.
All right, good stuff. All right, another thing, we're just going to hit all these main topics here. What about exercise? What role does that play in our heart health?
Oh, exercise is huge. Exercise, I mean, I'm saying all these things are huge, right? But these are basics. This is like the basic stuff of how your body functions. When you exercise, you make things like nitric oxide. So in the Healthy Heart Solution Kit, we talk about nitric oxide. And, you know, if you get a supplement, they often have like beetroot or arginine so that you can increase nitric oxide. But really, the way you get nitric oxide is not by taking a pill. It's by exercising. When you exercise, your body produces the enzymes that are necessary to convert the arginine into nitric oxide so that you can dilate your blood vessels and drop your blood pressure and improve your blood flow and not get damage to your arteries. So nitric oxide, it's big. And that's just one part of exercise. There's a whole lot of other benefits to exercise of decreasing inflammation, improving insulin sensitivity. And the insulin sensitivity is a whole another thing. And exercise is an important part of that. So that is exercise is an important part of anybody's life.
I have a question. What would you say to someone who has heart issues and exercise is good for them, but they're a little afraid that it's going to damage their heart even more?
Okay, so here's the simple way to look at it. Start small and work up. Don't like run a marathon the first day you exercise. That's not wise. If you already have heart disease, that guy that was playing tennis, well, you know, he couldn't even play a set at first, and but he was a tennis pro, so he knew tennis and he played a lot. But he was gradually working up to a full match. And so, you know, it's just starting from what you can do. Yeah, okay, I'll give you an example. Another example. I had a guy who was getting chest pain just walking out to the mailbox. The mailbox is at the street, so it was a bit of a walk out to the mailbox, 50 feet or so. Um, but he but he would get chest pain just in that 50 feet. So I said, okay, it's okay. Just get to the mailbox, stop, rest, and then walk back. And then the next time, just take another step beyond that. And then each day, just add one step. That's all, just one step. And you know what he did? And he was getting around the block. Last time I talked to him, all the way around the block without chest pain. And so, that gradual increase is the best way because changes are made gradually.
All right. Allison actually wrote in and has a question. Allison says, I am 73 years old. Welcome back, Allison, by the way. I think you're on the webinar yesterday too. So we're glad that you're here. I'm 73 years old and my blood pressure is usually good, up and down from 116/60 to 178/82. What is considered high blood pressure or dangerous? How do I get it down and stay down? Thank you so much.
Okay, thank you so much for that question. That is a big question, and it's not it's not what you think. High blood pressure is when your blood pressure is consistently elevated, when it's always up. If your blood pressure goes up, it comes down, up and down, up, down, no problem. You're good. But if your blood pressure is continuously elevated, you got a problem. And so the fact that when you're quiet and relaxed, your blood pressure can come down to normal, that's where it should be. You also need your blood pressure to go up. You need a higher blood pressure when you need more blood flow. That's why your blood pressure can go up and down. It's just like your temperature is going to go up and down somewhat. Your blood sugar is going up and down somewhat. Your pulse, your heart rate will go up and down. It'll go up to 150 when you're running. And then when you're quiet and relaxed, it comes down to 60, 70, whatever. The going up and down of the blood pressure means you are normal, that you have a good autonomic nervous system, well functioning. It's not good. And your rate of dying is increased by having stable low blood pressure. You don't want that. You want it to go up when you need more pressure, and you want it to come back down when you don't need the pressure.
All right, good. I had a question. Edith, I did get your email, and so I'm going to ask Dr. Saunders about this right now. Edith has been watching our webinars for several weeks. Edith has been on the Healthy Heart Solution Plan since March, been on heart medication for the last 10 to 15 years for irregular heartbeat and irregular blood pressure. I was concerned about the continued use of those medications and therefore contacted Barton about the Healthy Heart program. I added the turmeric black pepper to original supplements when she worked with one of our coaches. Okay, when I developed pseudo gout on both ankles and wrists and hands, I was put on prednisone and ibuprofen to relieve the pain and swelling. The blood test indicated change in CRP. So in mid-February, it was 0.7, and May 3rd, it was 4.3, 24 hours after completion of prednisone. I have an appointment in June with a rheumatologist. Pain and swelling has dissipated pretty much with continued use of ibuprofen 2 to 3 times a day. Is there any relationship between this flare-up and supplements that I may be using that began in March? Any suggestions for pseudo gout? Would you recommend continued use of prednisone, colchicine, ibuprofen? Okay. Or are these drugs harmful to me? I'm currently taking amlodipine 5 milligrams, Lipitor 5 milligrams, lisinopril 10 milligrams. I was told not to discontinue their use for at least 6 months after starting Healthy Heart program of supplements, lifestyle change, diet, and etc. I'm in my late 70s and generally maintain an active lifestyle. Over the last 40 years, I've been diagnosed and tested for gout 4 times, even though at the time I was told that my sex, age, weight, or food and drink did not verify that diagnosis. I'm now being told it's probably pseudo gout. I have never had it in multiple joints at the same time. In the past, I had it in my thumb, toe, and ankle several years between occurrences.
Wow. Okay. So they didn't actually diagnose you with pseudo gout. Because if you have a swollen joint, they can take fluid out of the joint, and they look under a microscope, and if they see calcium pyrophosphate crystals, and they go, that's pseudo gout. If they say uric acid crystals, then that's gout. That's regular. That's real gout. So they probably did tests when you had this in the past and looked at your uric acid levels and said, oh, the uric acid is okay. Therefore, it's not gout. And that's probably true. So, but if they didn't actually do a joint aspiration and look under the microscope to look at the crystals, then and they're saying it's probably pseudo gout, then you probably don't even have a diagnosis yet. You don't know what you have. And so the question then becomes, why do these flare-ups happen? Why do you have joint pains and swelling, the ankle, the thumb, all those different places? And the fact that it's in a lot of different places means this is a type of arthritis. And so what you need is a diagnosis. You need to find out why it's there. Pseudo gout is a metabolic problem. And you may have to change your metabolism if that's the problem, if that's the issue. So finding a proper diagnosis may mean, when you have a swollen joint, actually taking some fluid out and finding out if that's what's going on. I think normally what I would do is start testing. The next step is testing. Testing for what? Well, testing for metabolic problems. This is not something that just started yesterday. This is something that's been going on for a long time. So you have some metabolic issues that could be side effect of medications you're taking. You've been taking those for a long time too, many years. So it's not outside of the possibilities that medications could cause the problem. And then your question about the supplements causing the problem. Yeah, they can exacerbate it. It's not out of the question. And that's something that can be the test is really difficult for that. Well, not difficult, it's easy, but you can't be sure because there's years in between having a gout attack or pseudo gout attack or arthritis, whatever it is, that if you stop the supplements and you don't get any attacks for a year, does that mean it was the supplements? Well, not necessarily. That's not, because it's too long in between, right? So you can't be too sure. So where does that leave you? I would start with testing, and I use metabolic testing, and it's not the usual like metabolic panel that most doctors do. I would do something called a Nutri-Val, which is a nutrient evaluation, or a organic acids test, OAT. Those tests are things that can tell you where your organic acids are that often cause these kinds of things like the arthritis. If you have a lot of pyrophosphates, if you have a lot of different kinds of organic acids that could cause inflammation or toxic buildup at certain times, which is why you might have years in between. So testing would be the next thing. Find out what the problem is, because you may not need the medications.
Right.
Or supplements for that matter.
Yeah, and she said she's going to the rheumatologist in June. So maybe if you need some testing by then, before then.
The rheumatologist isn't going to do those. They might look for they might actually do a joint aspiration, something like that. So that might be useful. That would that would be useful.
So her primary doctor should do those kind of tests?
Yeah, no, the primary doctor would usually send her to a rheumatologist, and the rheumatologist would do the why do you have arthritis question, answer that.
Okay. All right, here we go. Anonymous said, what are some things to avoid if you're diagnosed with H. pylori?
H. pylori. Okay, so Helicobacter pylori is a bacteria that commonly grows in the stomach. It's very resistant to acid, so it can find a little niche in the stomach and start growing there, and often causes gastritis or ulcers. When it was first discovered, not that long ago, 15 or 20 years ago, there was a guy in Australia doing research on Helicobacter pylori because previously thought it was like, well, just everybody has this. This is a normal thing. There's just colonization. And he was doing some research on it and said, you know, I think this causes ulcers, and nobody would believe him. So he took a culture of Helicobacter pylori and drank it, and it started colonizing his stomach. He got ulcers. Then he took antibiotics and killed the infection, and his ulcers went away. And so they're like, oh, well, I guess that is can be a cause of peptic ulcer disease. So now, if people have ulcers or gastritis, they're often tested for Helicobacter pylori, and then the H. pylori is eradicated with a series of antibiotics. It's not just one. It's like you have to take a regimen of 3 different antibiotics for 14 days for 2 weeks. It's not just a simple kind of treatment. So that's one way of doing it. Another way to look at it is how does the body normally handle this and get rid of this, without taking antibiotics? The way to do that is this constant changing of the pH, where you have a really high pH. And by the way, a high pH is a low number. So a pH of 2 is a very high, is a very high acid. So you're changing the acid content. You get a low pH, which is always acid, right? And so you get a lot of acid and then none, and then a lot of acid and then none. And the way to do that is when you're eating and fasting periodically. So those periods of time of eating and fasting are something that prevents Helicobacter pylori from growing. So that's another way besides antibiotics to handle it. There are also a lot of different kinds of things you can take. There's essential oils of various kinds. I know someone who was taking little capsules of oregano oil and said that works really well. There's colloidal silver you can take that will also help get rid of H. pylori. And the way to keep it away is to have the changes in pH. So you have a lot of acid and then none. So when you eat, you make a lot of acid, and then you have a period of time of none, so that there's your stomach pH drop, or pH increases to around 6 or 7, and that helps keep it out.
Okay. So Edith, someone had asked this. If you're ever looking for a doctor that's like Dr. Saunders, we get asked this a lot. I would recommend just Googling functional medicine doctors in your area. That is probably going to get you the closest to Dr. Saunders. So, for example, Edith was like asking, what other doctor could do these tests for me? I would maybe go there if it doesn't work for the rheumatologist to do it or whatever. I would just Google that. We had somebody share, oh no, what's the testing site, Dr. Saunders? I wrote it down so I can look it up, but do you remember?
It was
It rhymed. Request a test.
request a test.
Okay, I wrote it down so that we can find it next time, but I wanted to try to remember it. And see, I didn't. Requestatest.com. That might be an option. I'm not sure. But yeah, I would probably look for functional medicine doctor. It says, what can I, okay, yes. All right, let's keep going here with some more questions. Teresa said, my recent MPO was over 800. What can I do to get that down? I know it's an indicator of inflammation.
Yeah, that's MPO is myeloperoxidase, and it's an enzyme. And when you have that enzyme, it's an indication that you have inflammation. And it may be mostly related to the blood vessels. Uh, uh, Not necessarily, but often that's the case. In which case, that's a risk for heart disease. So, so why is it there is a great question. Why do you have this high MPO? And the reason that happens is because of inflammation, and it mostly comes from diet. And so we've already talked about having periodic feast and famine. Whenever you stop eating, you shut off myeloperoxidase completely. It is just like it's on while you're eating, and then when you're fasting, it's off, zero. So well, it goes down, but it does shut it down. So the one way to handle this is periodic fasting or intermittent fasting. So periodic fasting looks like something like 3 days once a month. And then intermittent fasting looks like something like I have a 5 hour window of eating. I eat at 7 a.m. and noon, and then I don't eat after that. And that keeps the myeloperoxidase down really nicely.
Claire had asked, how dangerous is having a fatty liver? And what can I take to overcome this? I often take a few drops of milk thistle. Would this help me?
Okay. Milk thistle, yeah, we use milk thistle. But here's the issue. The question is, why do you have fatty liver? Fatty liver is also a sign of inflammation. It's also a sign of toxicity. The liver becomes fatty whenever it's toxic. So toxic on what? Well, if you were to drink what did I read about? Carbon tetrachloride, a cleaning solution. That creates fatty liver. If you drink alcohol, that creates fatty liver. You have then we have the non-alcoholic fatty liver, which is often from toxins like fructose. So people don't think fructose is a toxin, but it is to the liver. It's not sugar. It's not glucose. It can't be used for energy directly. It has to be processed. And if the liver doesn't process it fast enough, it becomes toxic and your liver becomes fatty. And it's probably, I would think, the number one cause of fatty liver is something in between either alcohol or fructose. Those are the most likely. So removing fructose. So what do you think? Fructose. Where is it found? Everywhere. What do fruits, sucrose. So sucrose is a vegetable sugar, is 50% fructose. Honey is 50% fructose. High fructose corn syrup is everywhere. And that fructose is creating problems, like fatty liver. Where else? Agave nectar and coconut sugar and all these things that people are saying, oh, this is good for you, right? Wrong. It's got fructose. It's going to create fatty liver, just like all the other sweeteners. So that would be a great place to start. If you think you may be toxic on something else, then that can be an issue too. So how do you get rid of it? Well, when you are not eating, when your stomach is empty, then your liver can rest and reset and repair and use up all that fat and regenerate cells. So while you're eating, everything you're eating has to go through your liver. It has to be detoxed and processed by your liver. So you have to stop eating for that liver to repair and regenerate. So just taking a pill like milk thistle is great, but that's not going to fix your problem.
All right, here we go. Lily says, recently had a PVC in the middle of the night. Fourth in 2 years. Thumping, spasms, lasted 1 hour. Didn't call 911. Went to the ER in the morning. Troponin elevated. Working on getting more mitochondrial energy, including L-carnitine. Trying to prevent another episode. But if this should happen again, is there anything to take that can relax the spasming or the thumping? 80-year-old female, blood pressure usually normal, but it can go up sometimes. Aortic dilatation 3.9. Healthy, mostly plant-based, 100 pounds.
Wow. Okay. So, the troponin elevated means there was damage to the heart. The troponin is specific to heart muscle. And if it's in the blood, that means the heart muscle broke open and released the enzymes into the blood, and now it's in your circulation. So they measure it in your circulation, and that tells the doctor that there was damage to the heart muscle. And so they would usually repeat that again and say it's going down. Therefore, it happened in the past and now it's decreasing. And since it was probably hours between the time that you had the episode and the time that they did the test, during those hours, it does decline. So they wouldn't have known exactly, how high it might have been if you had, gone to the ER right away, for example. So that's telling us that those spasms are not benign. It's not an oh well, don't worry about it thing. This is something to worry about. So how can you prevent it, and why does it happen in the middle of the night? That's not uncommon. But these, especially in women, are Prinzmetal's angina. But it's a the blood vessels in the heart constrict and slow the flow of blood, causing spasms in the heart and these contractions of the heart, and often the heart will beat faster, and usually there's like chest pain associated with, like pressure in your chest associated with it. And if that's the case, then it's important to relax those. And by getting the stress levels down, exercise is a really good way to increase something called endorphins that stop those from happening. And then dealing with stress and getting enough. You might try L-arginine. You may not be getting enough protein, and especially arginine. And what that'll do is allow your body to make more nitric oxide to relax those blood vessels and allow more blood flow.
Okay, thank you. Elmar says, about 2 years ago, I had COVID after, I can't even say these words or we're going to get banned. Okay, well, they can edit this. After 2 years of having that, and after 3 vaccines, I developed this syndrome. Sometimes I have palpitations, could be arrhythmia or just a faster heartbeat, once a week or 2 weeks. It lasts for a few hours. It never happens when I do heavy exercise like running or after I have a drink or two. Only when I'm doing nothing. I've heard that it's pretty common after one of these vaccines, and it should go away with time, but it doesn't. I could have blood pressure 115/75 and pulse 80 for 3 hours. My normal pulse is under 60 and can't do anything about it. Any comments on this?
Okay. Yeah, with the heart, that's an issue. Harvard did some research on this, and those who had the vaccine, they took young men. They took 50-ish young men who had the vaccine, who got cardiomyopathy, versus 150 essentially who had the vaccine who did not get cardiomyopathy, and they compared them, did a whole bunch of tests, and found out the difference in them was that the people that got the cardiomyopathy had persistent spike protein. So they're continuously making spike protein, and the immune system is not getting rid of it. So it's kind of like having the vaccine is kind of like having allergy shots where you get tolerance to it. And because you have tolerance, then you have the spike protein persistently circulating and doing damage. It's toxic. It damages the blood vessels. It damages the heart. And it can do other damage depending on which blood vessels are being affected. So yeah, generally it should go away, but sometimes there have been tests of people 6 months out after having these persistent spike proteins still continuing to have them. So there is one protocol that I've been using successfully. If you go on the website for the FLCCC, that's Frontline Doctors, and they have what's called the long protocol. And so you do their long protocol, and there's medications that you take. You'll need prescriptions for that, and supplements, and other things to do. I found that protocol can work. I found it to work on the people that I've tried it with. So that's the website is FLCCC long protocol.
I'm going to share that actually in the chat. It's not going to look like what he just said because it takes you to another place, and I just can't say the name of it out loud. So you'll see it. Okay. Let's see. Lots of good questions. Here's a question from Monty. Monty, how are you? Monty says, I'm hesitant to ask about how much impact does being a type 2 diabetic have on heart health? If you rank the controlling of type 2 in importance to your heart health, what would you rank it compared to other key items?
Okay, so rank it. Okay, so if cholesterol is a 2, then diabetes for heart health, type 2 diabetes of heart health is a 9. It's like so much more important. And you know, we look at blood pressure as if it was as if it was going to do damage to the arteries, but it doesn't. Blood pressure is always secondary to something else, like high blood pressure, hypertension. And so that would be like maybe also a 2. And type 2 diabetes increases the blood pressure as well. But that's like a secondary thing. The primary thing is it's damaging your arteries, and it's decreasing the energy system so that you have less energy to your heart. So you're going to have more heart disease, more arrhythmias, more congestive heart failure. And so it's not just like it does damage to the arteries. So we're not talking about just arterial disease. We're talking about actually having less energy in your heart. So type 2 is huge. It's really a big part of heart disease. And a lot of it is unrecognized because of the insulin resistance causing an inability for the heart to have energy, or having the heart having less energy. So yeah, it's big.
Krish, welcome back. Haven't seen you in a while. Krish is asking, does iron deficiency anemia affect heart function?
Oh, that's a great question. Yes, iron deficiency definitely affects heart function. You'll tend to get palpitations when you need more oxygen because your oxygen carrying capacity is less. And one of the problems with this is that the body does not care how much oxygen you have. If we were sitting in a room all together, just laughing and chatting, and somebody took all the oxygen out of the room and replaced it with nitrogen, we would just all be laughing and chatting, until we all passed out and died. And we would just be perfectly okay with dying in a room with no oxygen because your body doesn't care how much oxygen you have. Well, the only reason, well, the main reason for a hemoglobin is to carry oxygen, but your body doesn't care how much oxygen is there. And all you deal with is carbon dioxide. So now you have a decreased amount of oxygen. And so you start exercising and doing things, and your muscles and your heart is going, hey, wait a minute. We're not getting enough. You know, the carbon dioxide's okay, the pH is okay. That's all we care about. So then you start doing anaerobic respiration. Anaerobic means you're making ATP. Remember that exchange we talked about before? You're doing that exchange for ATP, but you're only getting, instead of getting 32 ATPs per glucose molecule, you're getting 2. That's all, 2. So you're getting energy, but it's very little energy. And so the heart starts getting problems like arrhythmias, and palpitations, those kinds of things. So yeah, iron deficiency anemia is an issue.
Good question. Thank you for that. Anonymous said, how do we know if we need K2 in the milligram range as opposed to the microgram range?
Oh, good question. Okay, so let me go just for everybody's understanding. Vitamin K2 has been shown to take calcium deposits out of soft tissues and put them into bones. And the reason that's important is because as our arteries age, we have less compliance. They harden. They get calcium deposits in them. And as the arteries harden, they're more like pipes, and there's not as, your blood flow is decreased. Your heart has to put out more pressure, so your pressure has to go up. And so all of these issues are related to calcification or hardening of the arteries, and even like clots in your arteries and organizing out calcium deposits. So one of the things that we want to do is to remove those calcium deposits or prevent them from happening. So if you have the microgram quantities of K2, 300 micrograms a day-ish, then that is adequate for prevention. But if you have significant amounts of calcium deposits in your arteries, then you may want milligram quantities. And so there's one company called Life Extension that puts out like a 45 milligram dose of vitamin K2, as opposed to most supplements that you get are going to be 100 micrograms. And so you can see there's quite a difference. There's 1,000 times more milligrams there than there is in a microgram. So 1 microgram is 1,000 milligrams. No, the other way around. 1 milligram is 1,000 micrograms. So, so that's a lot more. And so if you have a lot of calcium deposits, yes, you should be taking milligram quantities of K2. If you don't have calcium deposits, you want prevention, then microgram quantities are great.
All right. Rose says, what can I do for osteoarthritis naturally?
What can you do for what naturally?
Osteoarthritis.
Osteoarthritis. Okay. I was thinking osteoporosis. Okay. Osteoarthritis is a specific kind of arthritis called degenerative arthritis. So why do your joints degenerate? Well, because you use them. Everything degenerates when you use it. If you're driving your car, you're wearing out your tires because you're using them. You're wearing out the engine because you're using it. The seats you're sitting in are wearing out because you're using it. So you're using your joints, and your joints are going, and you're wearing them out. And so what is this itis thing, this inflammation? Well, it's not always inflammatory. Sometimes it's just wearing out. The problem is you're not repairing your joints. So why don't you repair your joints? There are several different possibilities. One is not being anabolic. So we've talked about this before. You've heard of the 6-10 reset. Stop eating by 6. Earlier is better. Stop eating by 4 is better. And then sleep by 10. So that what that allows you is to have what's called the anabolic metabolism. Your anabolic metabolism is rebuilding and repairing every single night. And if you don't, if you go to bed late or you eat late, then you just don't repair that night. Well, what big deal is that? It's not a big deal. But what if you do that night after night after night after night? What if you're not going to bed till midnight every night for 10 years? Then you haven't repaired anything in 10 years. And what are your joints going to look like? Well, they're going to look like they need repair. And that's exactly what happens. They wear out, they wear thin. And so some people have, really good cartilage, and it's a good thick cartilage. When you do an x-ray, you can see there's, good space between the bones. And some people are like bone on bone. Why is that? Because you've worn out your cartilage. You use it, and it's okay to use it, but darn, you got to repair it. So the 6-10 reset is a really important thing. Another thing is cortisone. If you have a lot of stress, then cortisol is a catabolic hormone. It breaks down what? Everything in your body gets broken down. People get cortisone injections in their shoulder. They have a rotator cuff tear, and so the doctor comes and I'm going to put a cortisone injection in there. And what does it do? It kills all of the inflammatory cells, so you have no inflammation. And you go, wow, that's awesome. But guess what else it kills? It kills all the cells that repair your joint. So you can't repair the joint. So you get degeneration. And if you do that too many times, it degenerates so badly that they can't even repair it surgically. They try and like stitch a tendon together, and there's nothing to stitch to it. Just the suture just pulls right through it, and it's completely useless. So then they have to take a graft from somewhere else and put it in there because you've degenerated those joints, tendons, ligaments, cartilage, all of that stuff so much. So cortisone injections are really bad, but even just the stress hormone cortisol, a constant level of stress hormone, is going to wear out your joints more. Another one is chronic inflammation. And this is not necessarily that you have like rheumatoid arthritis. This is just chronic inflammation from having high omega-6 we talked about earlier, or from having chronic infections of some kind, molds or Epstein-Barr or toxins. If you have a connective tissue disorder, you can also get osteoarthritis more easily. Certain connective tissue disorders, a common one, it's actually fairly common, Ehlers-Danlos syndrome, where people don't make their collagen fibers are not really strong. They make the collagen fibers, of course, that's what holds our body together, but they're not super strong, so they break easily or they stretch more, and so they wear out faster, and if they don't repair. So some people are lacking in a very simple, very abundant mineral called sulfur. And it's abundant, it's everywhere. You can't avoid it, but we need a certain form of it. We have to get it in organic form. It has to be bound to oxygens. So something like methyl sulfonylmethane is an organic form of sulfur that our bodies can use. If you just take a yellow rock of sulfur, that's useless to you, completely useless. And that's not an uncommon deficiency either. That's fairly common to get sulfur deficiency. So MSM is a supplement that you can take for osteoarthritis. Why? Because that's a common deficiency. And if you're deficient in that, and that's the cause of your osteoarthritis, it will fix the problem very quickly. And I've had a lot of people do that. They take it and they go, wow, it's amazing. Like in 1 day or 2 days, I was all better and my joints didn't hurt anymore. and you can actually repair that cartilage that's damaged too. Other supplements are things like chondroitin, glucosamine. These are things that the cartilage is made out of that helps repair the the damaged cartilage.
All right. Look at the sun starting to really come out over there, Dr. Saunders. I'm jealous.
Yes, it is. It's beautiful. Wow.
So fun. Okay, you guys, that is it for us today. Actually, Cheryl and I have to go to another meeting. So thank you guys so much for being here. Dr. Saunders, thank you for taking your time away from your family. Tell them thank you. We appreciate
You're
it.
welcome.
Enjoy the rest of your vacation. And we will see the rest of the week. I'm sorry to get to all the questions, but we'll do our best to get to those next week.
We
Bye.
had good questions today.
Oh, they were good. Very good. Bye, guys.
Bye all.